Hello, welcome back to the Life Transformer Show. It is another special episode where I am delighted that we are joined by the always fabulous guest, Dr. Sandar, and we are going to be talking on a menopause topic and a topic that I've said, let's just get stuck into it and not even discuss it beforehand because I don't know hardly anything, in fact, nothing about this. So we will chat about it. But first of all, hi, Dr. Sandar, how are you?
I am good. Thank you very much. And thank you for giving me space to talk about this.
Oh, it is so important. And I, the podcast, and I suppose all of the work that you do and us talking about this topic, I know it has been so helpful for so many. And the more we talk about it, the more we'll reach and educate. Because, like I was saying, we had a quick chat before starting this podcast and, kind of like didn't discuss it any much further before discussing it now because I don't know what we're going to be talking about. And as somebody that feels pretty educated on perimenopause and menopause myself and have had experience of symptoms, I'm obviously discovering that there is still plenty to learn. So today we are going to be talking about genitourinary syndrome. So can you explain what this is?
So, a syndrome is a combination of symptoms.
Okay.
So, we're going to talk about a unique combination of symptoms which are quite specific to the genital urinary area.
Okay.
So when we say genital urinary area, so female genital area, which is the vagina, vulva, and the skin around it, and the urinary, which means that the urethra where we pass the urine. And this area doesn't really have a lot of airtime,
Yeah.
partly because I think traditionally people don't want to talk about it.
Yeah.
And when people are having issues in this area, they they don't think that this is something you discuss, even with your very close friends, family, relatives. You still don't think that this is something you would talk about it in detail.
Yeah. Still
But
shame and embarrassment, isn't that?
yeah, but it is actually pretty much 100% of women in menopause, perimenopause will have symptoms in this area.
Yeah.
And some people might actually think that it is their fault for
Yeah.
not doing something right, even though they don't actually know what they should be doing to start with. But it does affect your relationship. Again, I do have like patients coming in and telling me that, well, my GP has prescribed me this vaginal estrogen. And some people actually think that this vaginal estrogen is instead of the HRT that you take it by mouth or on skin. They actually think like, well, I do the HRT through that way. And some people are quite happy doing that. And some people would actually think like, well, why am I given this vaginal estrogen? I have no interest in having sex. I really don't care what happened down there.
Yeah.
And I need to explain to them that is this area do not just exist solely for that purpose.
Of course. Yeah.
Because
Exactly.
that little area actually is the area where all the other muscles come and insert. And those muscles are the muscles that we call pelvic floor muscles.
Yeah.
And those pelvic floor muscles support your vagina and your vaginal wall. In the front, it supports your bladder. That is where your urinary bladder is. In the back, it supports your bowel. And on top of the vagina, you have got your uterus. So if this area is not actually healthy and strong, everything will just come down.
Yeah.
And that would mean that you are going to have incontinence of urine, incontinence of feces. Your uterus can actually come down. That would actually make you prone to infections. And the other thing is that syndrome is called genitourinary because menopause affects urinary symptoms. And people don't actually know how. Because in menopause, your estrogen goes down literally everywhere. And your vaginal tissue, your vulva, your labia all these areas actually depend on estrogen to be healthy.
Yeah.
So when your estrogen goes down, all of that area become really thin,
Yeah.
and the pH in that area changes as well. So your actual physical barrier to prevent you from having a urine infection is gone.
Right.
Your actual pH barrier has changed. So you do get a lot more urine infection.
Yeah.
So when I see a lady who's saying to me, I don't need a vaginal estrogen, I'm not interested in having sex, I'm like, yes, but your doctor actually didn't give you this cream for that.
Yeah.
We're given that because you were having a lot of urine infections. And sometimes you don't even need to have a urine infection. You just have an irritation. You feel like you want to wee all the time. You may check the urine, which probably doesn't show up any infection because you don't have an infection. It's just the area becomes so sensitive that muscles are acting a little bit weird, and that's why you get symptoms. And all of this can be treated with a little bit of vaginal estrogen.
Yeah. Yeah.
So this thing is called a syndrome because there are so many symptoms in it.
Yeah. Yeah.
We have got like dryness,
Yeah.
we got irritation, you may become more prone to thrush because of it, and you might be going to the toilet a lot more. It could be because you have got a urine infection, or it could just be that that area is really sensitive. And usually, the secondary effect of it is that you're already becoming very uncomfortable with that area. So
Yeah.
you really are not interested in this physical activity of becoming intimate.
Yeah.
And then to make the whole thing worse, menopause actually reduce all three hormones that you produce from the ovaries. So the estrogen, progesterone, testosterone, it all goes down. And the estrogen, for most women, if you give enough estrogen, you will get your libido back. But in some women, though, that's just not enough. You need a bit of testosterone as well.
Yeah. Yeah.
And again, when I see the ladies, they a lot of people come and ask me, I need testosterone. I actually need to explain to them again that testosterone will increase your libido, yes. But unless you actually have the physical ability to accept that down there,
Yeah.
there's no point in increasing your libido.
Yeah. Of
To
course.
do it, we're going to have to do both at the same time.
Yeah. Yeah. Uh,
So that is the basics of it. This syndrome is important because infections, irritability, dryness, that would basically put you off becoming intimate, and then that would eventually put you into a situation where you don't want to be intimate. You are actually risking your relationship. And even if it doesn't matter to you, it still matters that we maintain the pelvic floor muscles.
yeah. Yeah.
So, who needs treatment for that? I would say pretty much every perimenopausal, menopausal women need treatment for that. And there are many, many kind of treatments these days. So that's another one area I want to explain about
Yeah.
because I don't think people know enough about it.
No, of course. And as I'm listening to you now, so I've got the little, I can't think what they're called now, little silver sachets for the estrogen, a very low dose that I have, and it goes on the thigh every alternating. But I'm thinking now, well, I didn't know anything about this cream, and I suppose I'm not experiencing any of the symptoms at the moment now. So is it something that ultimately, should we choose to have HRT, that every woman is going to need to have the gel that they're rubbing in their thighs and their arms and this cream, or if you're only experiencing symptoms? So, because like I'm thinking, oh, well, I haven't got that, and do I need to have it now to prevent it, or do I have to wait? How does it work?
I think the silver sachet you're on about is testosterone, isn't it?
No, it's estrogen. It is. I can't think what it's called. Like
Okay,
says.
you have the estrogen, the HRT, the
Yes.
estrogen, the systemic estrogen.
Yeah. I can't think what it's called. Estradiol sachets.
Yes, yes, yes. So I think you got Sandrina, is that
That's
right?
it. Yes, that's it. Yeah.
So Sandrina is the systemic HRT, which you put it on. Who needs a vaginal estrogen? Definitely any woman in active relationship when they're still intimate. When a lady comes to me, I usually ask them, when you are intimate, is it comfortable?
Right. Yeah.
If it is comfortable, if you're all good, fine. It means that you do have enough estrogen to maintain that area.
Right.
It may be that your systemic HRT is doing enough that you are actually still having enough down there.
Yeah.
But with time, it becomes less and less.
Right.
And if you start to notice that you have a bit more frequency passing urine, if you are leaking when you cough, sneeze, laugh, jump, if any of this is happening, it means that your lower parts are down in estrogen and you need to replace them.
Yeah.
In your case, I think because you exercise so much, you probably have got really good pelvic floor muscles.
Yes, yes, I'm quite good. And I've done the Tesla seat as well, which because I do feel like I do have quite a strong one, but I was having this stress incontinence where if I was going to have two sneezes in a row, that was going to be scary. I'm not scared of two sneezes anymore. And also I remember saying about how this one time I went to a concert in the March and I couldn't jump up and down, dancing to the song to Fatboy Slim. But I went on the Tesla seat throughout the summer with the girls, and I know you work alongside them in 1192. They're amazing. I definitely would recommend going there. And then in November, when I went to go and see Fatboy Slim again, I was jumping up and down. I was like, this is amazing. I can jump up and down. So I am stronger now. And I do think that's a combination of working on that seat for sure.
Yes, yes. So if your pelvic floor muscles are really strong, it will compensate for the loss of the estrogen. And
Right.
if you started the HRT systemic a whole lot sooner, and if you haven't left it for so long, that again would compensate for the decreasing level of estrogen down there. So I think you basically have done everything, the right thing at the right time.
Amazing.
So that's probably why you're not noticing anything. But in majority of the women, they have one or the other or all of the symptoms of genitourinary syndrome. And depending on how troublesome it is, people would come and tell me, oh, I am having urine infections too often, or I'm really uncomfortable down there, or my relationship is in trouble because I can't do this. So those things, the point is that it is important to maintain that area, not just for intimacy. It is actually important for your general health.
Comfort, yeah.
Yeah. And the other thing is, it's pretty easy to do it. Only thing I do tell my ladies is that people tend to expect the results very quickly, though.
Right.
So somebody would come and see me. They would start using. We can do it in different ways. You can have a cream. You can have a pessary. Even with a pessary, they like different kinds of pessaries with an applicator or with a like a bullet kind of thing. Whichever estrogen you use, it takes at least about a month to repair what has been diminished.
Right.
So do that thing for about like a week, and then or some people actually do it less than a week, and then expect it like miracles.
Yeah,
And
cool.
what might actually happen is that because they are expecting it, their partner is expecting it, some activity happened, and then they ended up being in pain.
Yeah, of course.
That's another part of it I wanted to explain to my patients and their partners that yes, it's treatable. Yes, we can change it, but be patient
Yeah.
because this change didn't happen overnight. It happened over months,
Yeah.
and you can't repair that thing within a few days. We
Yeah.
have to be patient. It has to be at least about a month, and I also ask people to use their lubricants and moisturizers at the same time as well.
Yeah.
So it actually requires some very open and honest conversation with your doctor.
Yeah.
And I would like to advise women to bring their partners with them because if their partners understand what we're dealing with, it would be much smoother.
Yeah. Yeah.
And the other part of it is that relationship intimacy is not just one thing.
Yeah.
Because when I work with my patients, I also work with a relationship expert, so they can actually fill in some of the gap as well.
Yeah.
So this syndrome is actually a huge thing, which comes from the brain to the all the way down there. There is the whole hormone axis, which has been influenced by your hormone levels, your physical health, your mental health, your relationship with your partner, everything.
Yeah, yeah, so important. I think what you mentioned there about partners being involved with these conversations, because I suppose you can understand on the other side that if they don't understand what's going on with the symptoms and the everything that comes with menopause, they'll take it personal and then they'll think that it's something to do with them. But understanding this then will hopefully help them not to take it personal and to get upset and to have a lot more understanding. And it just boils down to communication. And I think, like you mentioned there, if every woman is going to experience this, it's not, oh, it's one or two and embarrassment and shame and I can't ever admit this, or go and seek the help because of shame. If this is going to happen to everybody, then be ready for noticing maybe the first sign and go and take some action, because for comfort, for being able to go out to not worry about needing to go to the loo or having an infection where you're going to be unwell, and your relationships is so much, isn't it?
And the reason I wanted the partners to come together is sometimes, though, women and men in a relationship usually are pretty much same age.
Yeah.
Women, it's traditionally accepted that a woman of certain age is going through menopause, and when a woman started to become irritable or not like their old self, a partner might think that, oh, they might be actually going through the change. But men actually going through a change as well, and their testosterone actually goes down.
Yeah.
So when a woman is still struggling with her own sexuality, the man might be as well. And if they're not actually honest about it to each other, it actually creates a whole lot of problem.
Yeah.
We have got couples who the woman is coming to me trying to change her part, and then she might come back and tell me like, well, this is not happening because he's not actually understanding, he's not actually coming forward, etc. I'm like, have you actually asked him? Does he have any problem?
Yeah.
Because most relationships are pretty much the same age.
Yeah, of course. Yeah, and they're going to have a change in hormones themselves, aren't they?
And men, I would think, are actually less likely to admit than women.
Yeah, 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 absolutely.
Because at least we women might talk to each other with friends.
Yeah, 100% we do. We're brilliant at that. Yeah, that's so good. And I suppose would then in that kind of scenario, it would bring an opportunity for, if you're talking about something that's very personal with a GP, then at that point, maybe a guy, if the partner is a guy, would then open up and go, actually, I'm feeling like this too. So it might give them that opportunity to feel like, maybe they couldn't feel that they could raise it before, but they feel that they're in an environment that is quite encouraging for them then.
Because in my experience, it's actually much easier when you got a third party.
Yeah, yeah,
And if I make it as in something general that happens to everyone at a certain age, people find it a bit easier to open up
yeah, of course. Yeah,
because when they are on their own, they keep thinking about it in their own head. It develops into something else entirely different. If
yeah,
I am actually with a couple and if I explain to them that, okay, so you are experiencing this and that happened at this age to pretty much both sex. So what about yourselves? Do you find it and sometimes I actually ask them as in like if the wife is not interested, not wanting to be intimate,
yeah,
how do you feel?
yeah,
How do you actually perceive that? And that actually helps
yeah,
because I had like ladies coming in and telling me one was some may be really, really upset because they think that their partner isn't exactly understanding their situation and they are expecting the thing that is totally impossible, etc. And some of them maybe on the other end, they be like, I told him, just divorce me. I don't care. I'm like, oh, that's not necessary.
Yeah, of course, you could see why it would happen, though, isn't it? There's so much stress and I suppose misunderstanding around it all that actually is a workable thing and you can figure things out.
Yeah. So it is a different area of menopause, which people should actually pay attention to
Yeah.
and explore it and discuss it a bit more. Because I still have patients coming in telling me about sweats, flushes, aches and pains, memory, tiredness. The rest of it, I have to ask.
Yeah.
Even when I ask, and even if I offer a treatment because they actually do have symptoms, people are like, oh, do I really need to do it? That's a bit of a palaver.
Yeah.
There are so many different treatments now that if you are happy doing it all by yourself, there are treatments that you can do it at home. If you do want to have a treatment in the clinic, there are treatments you can have it in clinics as well.
Yeah.
Because some people just don't want to be doing it at home,
Yeah.
or you can actually combine it. You
Yeah.
can combine at home treatment and also be coming into clinic, and you can have these light therapy treatments these days now. Basically, you have wands with
Okay.
lights. So some lights are laser, some lights are radio frequency. So there are many things you can do.
Yeah.
There's really no reason to suffer from it.
No, of course. Absolutely. And the cream you mentioned and is it pessary that you said, are they daily then or weekly or?
Depend on which ones you are using. There are some creams which are very low dose. So the very low dose ones, depending on I usually examine the patients. So depending on how the skin quality is like, whether they got any prolapse or anything. So if somebody has got prolapse, the skin is very thin. If I'm using the low dose cream, I ask them to use it about 4 to 6 weeks. If I'm using the high dose ones, though, the high dose ones usually come as a pessary. So they're usually quite effective within about 2 weeks. And then after that, you do it about like twice a week.
Right, okay.
And sometimes, they initially, because you did it quite intensively, the area repairs. And then when you actually reduce it back down, that repair may not actually kept going on. So sometimes you need a little bit of a boost again.
Yeah.
Because the dose is tiny, tiny, it really can't harm.
Yeah.
Unless we know that there is a cancer of a female origin in that area which is currently active, most people can have it.
Yeah. Brilliant.
There are some breast cancer patients on a certain drug who can't have it.
Right.
But other than that, most people can have it.
Brilliant. This is so good to know. And I'm sure there'll be plenty listening to this now thinking, I need to go and see my GP about this. It's really important
I
information.
mean, there are other like simple non-medication physical things as well. So there are websites that I would direct my patients to where they can buy some stuff.
Okay.
Some people can't do anything because literally closed up.
Yeah.
There are some websites that I would actually direct my patients as to, okay, you can use these, which will eventually dilate things. You can
Okay.
lubricants, which you use every day or every 3 days. There is so much out there
Yeah.
that a woman can be perfectly healthy and happy
Yeah.
top to bottom.
Yeah.
There's really no reason to suffer from anything.
Yeah, absolutely. And that's good to know with those links as well. That's excellent. Um, women can get in touch with you, can't they? And get your advice with your practice and your private consultations and everything. What's the best way for anybody listening to this now that thinks, oh my gosh, I want some more advice and get checked out or something? What's the best way for everybody to find you?
I am in 1192 on Saturdays, and I'm in Santa Maria on Thursday mornings. So those are the two get in them the two best way to get in touch with me. I also work for a IGP, which is the Independent General Practice. So their clinic is in Carmarthen. So I'm literally everywhere.
Yes, yeah, you are. Excellent. And you're on social media as well that people can follow you. What's your name on there? And I'll link it as well.
Facebook is just my name, just Sandra Hlaing.
Yeah.
Instagram is Dr. S Hlaing GP.
Fab, excellent. And what I'll do is with the show notes on this, I'll make sure that they are linked on there so anybody can just tap it and follow you. And you're always sharing really helpful advice and tips and always so motivational. Is there anything we haven't touched on yet or anything you wanted to mention before we finish off? There's so much that well, I know that I've learned on this, so I know I'll be ready when I feel I need to.
Not so much on my side. I mean, I could talk a lot about it, but the main thing is if somebody offers you treatment for that area,
Yeah,
don't just dismiss it. If
yeah,
you don't know what it is for, ask your doctor, why am I taking this for?
yeah,
Because you may be thinking about like, oh, this is just for my relationship and intimacy, and I don't need it.
yeah,
But a lot of the women, when GPs prescribe it, it is to do with the urinary symptoms or to do with the incontinence, to do with the muscles or the area of their skin quality, these sort of things. And if you don't see benefit with one treatment, don't just dismiss the whole thing off, because there are so many other different preparations that you can try. And if you are somebody who don't like at home treatment, there are clinic treatments as well. There's plenty.
Oh, it's brilliant to know that is. That's so good. And again, something that I didn't know about, but good to know that there's many options with it as well, because, not everybody gets on with the first thing they try straight away. This is amazing. Thank you so much for agreeing to be a guest and sharing this again. It's such an important topic, and women need to be empowered and educated with all of this. And hopefully, if there's anything more that you feel that we can be discussing and chatting about and sharing, that you'll agree to come and be a guest on the show again. So thank you so much for the chat today. It's been really informative, and I'm sure lots will get the benefit from it. Thank you so much.
Thank you.
Excellent. And if you want to get in touch with Dr. Sandar, I will make sure that the links are in the show notes of this podcast so you can get those there. And if you've ever got any questions, you know where I am. The podcast is out every Tuesday. So do subscribe and keep on listening. And I will catch you next week. Bye.